So, welcome to Unit 4, Promoting Health in Patients with Immune Disorders. Here we have 5 chapters, and in today's video we have chapter 19, Coordinating Care for Patients with Immune Disorders. The other 4 is chapter 18, the assessment, the chapter 20, coordinating care for the patient with connective tissue, chapter 21, coordinating care for patient with multi-drug resistant, and chapter 22 is coordinating care for patient with HIV. So moving forward. Med-Surg chapters are about 50 pages long, and half of the time you can't tell what is important. This video will help you to see it all fast. If you are a nursing student, this could save you hours of rereading. And if you are here just to better understand the conditions, I hope this makes the topic feels less intimidating. Hi friends, and welcome back to my channel. I am Nurse Mia, and this is part 2 from the Surg RN chapter, the outline from the Gets Zen RN Study Group series. Before we get into the details, I always like to zoom out first to look at the big picture of the chapter. I use a concept map like these to break it down heavy chapters so you can see the full path of disorders, lab intervention, all at a glance. You'll know exactly where to zoom in and what to prioritize. It takes the pressure off and makes the chapter easier to follow. Comment below which section of this chapter feels the most overwhelming for you. The goal? 1 page of clarity you can revisit in minutes. A map turns 60 pages in 10 minutes of review. Clean path, less noise. You will know where to start and what to skip. Let's get started. Welcome to chapter 19. So this chapter provides a foundational overview of a primary and secondary immune dysfunction, which are categorized based on origin, congenital versus acquired. But also it provides not just primary and secondary, which they're here, but they talk about excessive and hypersensitivity, and this one has 5 types, not much on the 5th, so that it's like an overview. So the immune dysfunction can range from minor immunodeficiencies to life-threatening systems compromise and include autoimmune condition and hypersensitivity reaction. So as I'm going to say that they have 2 overviews of introduction that starts the chapter. So the introduction is the immune system protects against microorganisms via 3 lines of defense, which is mechanical, inflammation, acquired adaptive immunity, innate immunity, which is a non-specific rapid first exposure. Adaptive immunity is specific, creates memory, lifelong protection. Roles, it's for cancer protection, tissue healing, disorders, it's like deficiencies or over activity. Deficiencies means increased disease susceptibility. Overactivity, it's anaphylaxis and autoimmunity. So we go, and I'm telling you that the overview of the primary and secondary, which kind of makes an introduction to almost the whole chapter. So the primary, it's the congenital, genetic. You see, it's like 200 diseases identified, rare, often in childhood onset, may involve T cells, B cells, the NK cells. You see the secondary here causes the HIV. So here is like a short what the chapter is structured. So one, it's introduction. Second, it's primary immune dysfunction, which has B cells and T cells. Then talks about secondary immune dysfunction. And then 4 is excessive immune response. Not much about, it's a table the book shows. Then 5, it's a hypersensitivity reaction. I wrote here 4, but there are 5 actually. And I will show you. Let's go. A little bit of glitch on my part, but this is a chapter 19. So this is the zoom out introduction. Talks about 2 overviews that I talked already, and then I introduced the primary and the secondary. I talked a little bit about this earlier. So you see the primary, it's a B and T cells, and the B cells has these 2, and then the T cells these 2. Little bit about secondary. Here is a table, and the hypersensitivity. I wrote 4, but they are 5 because I didn't have more space on the page. But as you see, AP, patho, clinical, here for nursing management, all of them has the same. And I'm playing too much with my light. So take a short screen, and if you like the chapter outline, this chapter is quite long. I have a shortcut, but also I have a longer one. More detailed one has like 10 pages of, right? And but it's very nice and organized. So moving forward. So now we are in primary immune dysfunction, and has the B cell, T cells, and B cells has these 2, and here T cell. So I have, as you saw in my concept map, that B cell has these 2, and they have AP, patho, clinical, and then the nursing management, same for all of them. And I have a slide for each of them to kind of help us a bit to understand what those mean. And so the B cells, you know where are made and what are they from the previous chapter. So the B cells deficiencies affect antibody production, leading to recurrent infection, particularly of the respiratory and gastrointestinal tracts. The X-linked gamma globulinemia, it's an inherited condition where the B cells are virtually absent, resulting in minimal to non-immuno. So the way you should I should remember, it's X linked, then and then it's A for missing. A, it's always like 0, right? A means that nothing. And then the common variable immune deficiencies leads to a low immunoglobulin levels, and it's typically diagnosed in adulthood. And then selective IgA deficiency, it's in the most common B cells defect and can present with mild symptoms or severe allergic and autoimmune condition. Then the T cell immune deficiencies are deficiencies impair the body inability to fight viral, fungal, and protozoal infection, often leading severe illnesses in infancy or childhood. The deletion in chromosome 22 causes the DGeorge syndrome and affects the T cell development due to thymic hypoplasia. So moving forward, you're gonna see some slides for B cells and T cells. You see here we have the X-linked agammaglobulinemia. You see epi, patho, clinical, and then some diagnostics, treatment, complication, nursing management. So you see here severe this will be complications, severe bacterial infection, chronic viral enterovirus, polio, and live vaccines. So take a short screen, but this is actually copy and paste from my own outline. So now you see, let's see. You see it's less than about 1 in a quarter in male newborns. And the onset it's in 6 to 12. See no antibodies, pneumonia, family history, B cells count. So that's why it's important for nurse to have the family history. But some people, they don't know family history, and that's why it's good to have the B cell count. Okay, moving forward. The other B cells, they talk about this little bit, not much. So you can take a short screen. So this is the part 2 from the primary. Earlier was A, this is a B, but it's T cell. And here is the DGeorge syndrome. Take my light away and you can short screen. Here it's the other T cells, a little bit of these, and usually the labs is very important to have a clue what it's all about. Just kind of have a glance. Okay, moving forward. We are in now the secondary. Make a little bit confusing why it's here 3 and here it's secondary, right? So the secondary immune, it's like the accurate and develops after birth due to external causes. So the causes can be HIV, chemotherapy, radiation, malnutrition, burns. The majority of adult immune deficiencies will have like accurate immune dysfunction results from external factors, I said. And here you see it's a glance from my outline. Little notes I took. The therapy-induced deficiencies causes, medications, radiation, surgical removal, the patho, chemo kills rapidly, dividing immune cells. The management is to prevent hand hygiene, avoid sick contact. So with this, like in NCLEX, when you have like safety and infection, which we all gonna get in NCLEX, will be about to avoid sick contacts and the hand hygiene, how important it is. So report early signs like fever, UTI, cough, wounds. Nursing will assess vital signs, the white blood cells count for infection signs, teach infection prevention, avoid crowds, pets, low bacteria diet. So moving forward. So here in excessive immune response, I said it's just a little table, not much about it. We'll talk, it's kind of an introduction here about it. So the contrast with deficiencies is like the immune system, it's activated inappropriately or overreacts. So in contrast to the immune deficiencies, when the immune system is initiated improperly or when it overacts, autoimmunity and hypersensitivity disorder occur. So the autoimmunity is when the body initiate an immune response against self. Antibodies are formed that responds to normal healthy cells and tissue. The body fails to recognize those normal cells as self, which causes an immune reaction to occur against the perceived antigen, the healthy cell. The cause of autoimmune disease is still not completely known. Theories of causation include the inheritance of susceptible genes that may contribute to the failure to self-tolerance, even with a genetic predisposition. Some trigger is required for the initiation of autoreactivity. This may include an infection such as a virus or medication, hormones, or environmental factor. So moving forward, and here it's the hypersensitivity reaction. So the overview, the immune overreaction to antigen or self-antigen. So they have 5 types, I said. Here it's a glance of all 5, what it's all. And we should go to the type 1. Type 1, it's the IgG mediated, leads to histamine release and symptoms like urticaria, angioedema, bronchospasm, and hypotension. Rapid onset often requires emergency intervention with epinephrine and airway support. So you see the type 1 has the epipathoclinical manifestation diagnostics. We'll see the increase in eosinophils, allergy, skin testing. The treatment is to avoid antihistamine because with allergy, steroids, epinephrine, oxygen. So always you think about ABC. Nursing care is to assess the severity, monitor airway. So here when you assess the severity, it's a lot of in NCLEX, what is the most concerning, most priority. So here you assess the severity. Monitor the airway, ABC. Stop anything that might lead to it. Oh yes, and medic alert bracelet. So you see here the patho is IgE. Okay, we go to type 2 now. Type 2, cytotoxic, antibody mediated. The IgG or IgM antibodies target cells leading to lysis, seen in hemolytic anemia and transfusion reaction. So keep in mind transfusion reaction with blood, then think about what you know about transfusions, what you know about blood, because will be in an NCLEX for sure, and can be like in infection, maintenance of care in those category, basic care. Okay, management, remove offending agent, and then you see clinical manifestation, transfusion reactions, fever, chills, rash, renal failure. Keep in mind of renal failure, cut posture. So keep this in mind because might be tricky question in NCLEX for this. Now we are on type 3, immune complex mediated. Antigen antibody complexes deposit in tissues and those causing inflammation like lupus. So you see here examples, and then the patho is the IgG, the manifestation, management, epinephrine for severe reaction. Always you need to keep in mind for allergies, and ABCs. Now we go to type 4 and 5, which is very, very short. I say here is very short, but this slide is so detailed. So I like when I made it in the book, earlier in the chapter, I said about my brain concept, my brain map, epi, patho, clinical. So I just like to go by this little by little, just few words of each of them to keep myself very short. So you see here in delayed cell mediated, the T cell mediated response occurs between 24 to 72 hours after exposure. So it's an example, very famous TB testing, the skin. No antibody involved, inflammation driven by T cell and cytokines. And so the type 4, I said about the TB skin, the patho is the T cell mediated, the cytokine release, macrophage recruitment, inflammation, delayed onset, manifestations, local dermatitis, you know that wheal and flare, conjunctivitis, rhinitis, severe latex. So here is anaphylaxis management. It's to prevention, avoidance, antihistamine, steroids, epinephrine if severe. And now we go to the last. Type 5. We made it to the end of the chapter. This is not much in a book, very short. So the pathophysiology is the auto antibody bind to cell receptors, continuous stimulation, altered cell function, not destruction. So the example is in the Graves' disease, autoantibodies stimulate the TSH receptor, excess thyroid hormone can lead to hyperthyroidism. So keep it nice and short, and few words for like an overview, patho, and some clinical example, and that's it. It's time for me to check out now and to tell you all my thanks to you and my last goodbye for you. Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing students who might need this too. Everything we cover connects back to the real nursing, whether it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.